Good afternoon and welcome back to the third and last session of teleconferencing for healthcare waste management today, and our last session also for your batch. Now we will be taking the session on treatment technologies for healthcare waste management, for which I would request Dr. Megha to take this presentation. Before she starts, I would again request you that any questions you have, kindly call in, dial in and ask the questions. Since kindly do not keep noting down whatever is being spoken, because in case you require the material can be sent to you, because in any case we will be having the videos prepared out of these slides. So please ask whatever doubts you have and interact, use the session since it is a live session. And I would request Dr. Megha now to discuss and tell us what are the treatment technologies that are used for managing the healthcare waste.
Thank you, Dr. Guba. Thank you, Dr. Guba. I once again welcome all of you to this session. We have already covered various important aspects of healthcare waste management. There's another aspect that we always talk about, and before we actually were talking on training and awareness, all that we would talk upon was only technologies. So, but now we get to know that technologies are not the only answer to healthcare waste management, but it's the entire concept of waste management, straight from segregation, collection, transportation, storage, technologies, and apart from training and awareness programs. So though it's still a very important aspect, there are different kinds of technologies that we use in treating healthcare waste. We'll be covering all the burn and non-burn technologies. As you can see in the slide, waste treatment means this is an important step of waste management, as it renders the waste decontaminated and non-reusable and prevents the spread of infection due to healthcare waste. So still, as we can see, that waste treatment is a very important aspect of healthcare waste management, because it renders the waste non-infectious. If we don't treat the waste and just dispose it off into our municipal bins, we are spreading the infection to the entire community. So it's very important for us to treat the waste before we dispose it off into the community bins, or sending it for recycling, or for rather any purpose. And waste treatment technologies, as we've already been earlier talked upon, they can be basically divided into two categories: burn technologies and non-burn technologies. The burn technologies are basically they're based on heating systems. They're high thermal heating systems, and the non-burn technologies can be divided into different categories based on heating systems, which are low thermal heating systems, chemical-based systems, biological-based systems, and the other technologies, the other innovative technologies that are coming in nowadays. And first we'll talk upon incineration. Incineration was the only technology that was available up till early 90s in India, when we talked about waste management from the healthcare facilities. Initially, the incinerators that were available to us were single-chambered incinerators, and they were just a closed furnace actually, and everything was just put into these incinerators, and we would just burn the waste. And rather than controlling the infections within the waste, we were spreading it further in the form of chemicals that were eliminated into the atmosphere. And from the single chambered incinerator, which was a fashion in late 70s, we realized the problems of pollution were there, and then we switched on to double chambered incinerators. Double chambered incinerators is basically, it has two chambers in it. Single first chamber, which has a burning, where the burning is done, and second where the pollution is controlled. It's a burn, as I said, it's a burn technology, burns the waste at high temperatures. It has a very high operating cost. And the other points that need to be noted here is a lot of pollution still has been emitted, and dioxins and furans are the most well-known pollutants that have been disposed of from the incinerators. And then we have the ash and the heavy metals that are again produced. the ash, the fly ash that's been produced from the incinerators has a lot of heavy metals in it, especially cadmium, lead and mercury, which leach into the soil and enter into the municipal dams if the fly ash has not been disposed properly, and through the water cycle, and it reaches us. And that's the reason why incineration nowadays has been discarded to quite a lot an extent, because we've realized the problems that have been associated with incinerators.
You haven't mentioned in the double chamber what happens in the second chamber.
I have a slide actually, so I thought I'd just reserve it for the next slide. So otherwise I would have just done it there. So it's, and then okay, then maybe we can come to the next slide, and then I'll come to these hazards. Incineration standards, as we've been discussing, the certain incineration standards that are there, which the CPCB and the Gazette of India, the 1998 Biomedical Waste Management and Handling Rules emphasize on. The incinerator has to be a double chambered incinerator. No single chambered incinerators are allowed. The combustion efficiency of the incinerators has to be 99%, which is just not achievable. So it's the reason why we are all saying no to incinerators. And thirdly, as I said, the cost of incineration is very high, and the primary chamber, as I said, is a chamber where the waste is burnt at a temperature, as a prescribed temperature of 800 degrees centigrade plus minus 50 degrees by the Pollution Control Board, and the secondary chamber where the temperature is 1000 degrees plus minus 50 degrees. And then the secondary chamber it's basically the gases that are coming out of the burning of the waste are there in the secondary chamber. They have to be there with an oxygen, because in the primary chamber it's without, burning is without the oxygen, and in the secondary chamber the burning is with oxygen. Here the gases have to be there at least for 1 second. The secondary chamber, the gas resistance time is at least 1 second, and here we have certain pollution control equipment that are there, the scrubbers and all that have been installed, wherein where we try not to emit the dangerous gases into the air. And here we again there's a chamber, there's a chimney, a 30-meter chimney that has to be there with the incinerators, so that it's just been disposed of into the high air. But we have come across that incineration within the hospitals, if it's a small hospital, say a 50-bedded hospital, initially the rule said that 50-bedded hospitals could have incinerators, but then the running efficiency of the incinerators, the standards could not be maintained by the incinerators. So that's how and it was and the pollution, the running cost was very high. So the incinerators now are mostly only with the tertiary hospitals and the centralized facilities. So rather in a city like Delhi, it's said that 4 big incinerators are sufficient, because it's only the anatomical waste that can be sent into the incinerators.
You told the disadvantages of but what are the advantages of an incinerator over the other methods which you will be discussing later on?
See, nowadays it's actually important, the advantages, there are a couple of very few advantages that are left over the disadvantages now. The one biggest advantage is that the waste, you have hardly only 1% of the volume, waste volume reduction is there, more than 90% of waste volume reduction. That's the biggest advantage. But over that advantage, the disadvantages are so many that we need to understand that incineration is not the technology that we're going to talk about in the future years. It's only going to be limited to...
So there's only historical importance.
Now it will be mostly historical importance, but yes, it's still important for...
terminal,
yeah.
It's a kind of a terminal event where you, there's no getting back anything.
No, but it's not in the form of solid form, but gaseous emissions are definitely there.
Yeah, that is that. So but the things will never be reused because it's a terminal disposal method.
Yeah, that's definitely there. But here it's still important is still there because the anatomical tissues and it's basically for the body parts, the anatomical tissues, wherein the other technologies are not at all effective, where the autoclaves and the microwaves and all cannot be used effectively. So it's where the incineration is important. And rather they've been in the rules in the Gazette of India also we talk about deep burial, where incineration is only permitted to populations of more than 5 lakh and above cities. So where we have populations less than 5 lakh, we have deep burial options for anatomical parts. So I've already, I think, we touched upon these emissions here: production of incomplete combustion, particulate matter, dioxins and furans, and ashes. We'd earlier also discussed the dioxins and furans are most potent carcinogens, and they destroy the endocrine system, the reproductive systems. So I guess that if at all it is really important for us to install incinerators, we need to make sure that the working standards are maintained. We ensure that all the pollution control equipment are installed, and the worker safety, the worker employees who are working really take care of all the the safety precautions there. And then to the non-burn technologies. There are different kinds of non-burn technologies: thermal, chemical, irradiative and biological. First we'll talk about the thermal non-burn technologies. They're based on different concept. Thermal is with using water and without using water. Here first we're talking about is autoclaving. Autoclaving is traditionally been used in the hospitals and in the healthcare facilities for several years, not for waste management but for sterilization purposes. So it's a very familiar technology, and the hospitals are readily accepting it for waste treatment. It's only in 1970s that we started autoclaving for waste treatment, but now it's getting very popular because of easy handling and usage. There are two types of autoclaves that have been used: the gravity displacement and the pre-vacuum autoclaves. As you can see, autoclaving is high temperature and pressure based systems using steam to sterilize waste. And as I said, the types of autoclaves are gravity displacement. Here we just use the water pressure, the steam pressure to displace the air, and the pre-vacuum system where vacuums is used to evacuate the air, and then the steam is introduced into the autoclaves. Then different pressure, temperature and time combinations are being prescribed for effective autoclaving and disinfection of waste. Then we have gravity flow autoclaves. The temperature, if we have a lower temperature, we have a 15 psi pressure for and then for 60 minutes, and similarly if we are increasing the pressure and the temperature, the time duration goes down. Whereas for the pre-vacuum type, here it takes a shorter duration, and 121 degrees centigrade at 15 psi for 45 minutes, and 135 degrees centigrade 31 psi for 30 minutes. So this is the standard that have been prescribed for autoclaving. Then there are different advantages and disadvantages that are associated with each technologies. So as I said, the advantages with the autoclaves is that it's a proven technology. We've been using it for long. We know that it's an effective technology, and it's because we've used within the hospitals for sterilization purposes. The second major advantage is minimal emissions. If we are properly segregating the waste, we make sure that the minimal emissions, there are no gaseous emissions that are there, and then relatively lower capital cost. It's important to also look into the aspect of the cost. As I said, incineration had a very high capital cost investment and both running cost. Here the running cost is very limited. If you have a laundry or something attached to your healthcare facilities, the steam that's coming out of the laundries can be used for running of the autoclaves, and it's only basically the electricity. And here, but the disadvantage here is that the waste is not reduced in size, and it's also visible as waste. You can, if it's kind of visible, it is still recognizable. There is no volume reduction, and it's very important to use a shredder and a mutilation technique while we are having autoclaving. And there's another disadvantage is the odor that we get out of it.
Plus we have to, here I would just like to mention, in a setup like ours especially, it's quite space occupying, you know, these huge autoclaves that you have which are horizontal ones.
But the incinerators also have, I mean, just comparing it with the other technologies.
But within the departments, the sterilization autoclaves are different, And these
But you have
waste
different size
you have to
autoclaves
have
because the size of your hospital is so big, you need a big autoclave. But the smaller hospitals and nursing homes which can just go for a 5 kg or a 25 kg one, they don't need the bigger
so
ones.
for every department to have, I mean, it's
No, not
estimates
department, but yeah, but for the nursing homes
for
I'm talking
smaller
about.
setups,
Yeah.
there's nothing like it.
Yeah, but for a bigger setup where the quantum of waste is so high, you need a bigger autoclave,
Yes.
of course. So that's where the size variation, that's an advantage that they have different sizes, straight from 5 kgs up till the one that you have is around, I think, 1700 liters a 1 hour cycle. So there are different volumes and sizes that are there, so that's the advantage.
What are the wastes which you normally put for autoclaving, and whether the waste for putting for the pre-vacuum and the gravity type are little different?
No, the wastes are all the same. The only thing that we have to be careful is all kinds of waste can get into an autoclave, but as we said, we have some problems with the anatomical waste, and so we don't put in the anatomical waste. The cytotoxic waste cannot go anywhere. That's really needed to be careful. All the cytotoxic and the radioactive waste cannot be sent into any of these technologies. Incineration, yes, but not the ones that are installed in the hospitals, but the ones which are there with the centralized facilities and for hazardous waste. So we need to make sure that we send it across to those facilities there. So that these are, and waste oil waste can be very well treated in an autoclave. So that's the thing. And then there's an advanced autoclave that we're talking about in the next slide is an hydroclave.
Hydroclaves, yeah.
This is again a steam-based system. Can we have a slide, please? The hydroclave is a steam treatment with fragmentation and drying of waste. Here, what happens is basically there's a double chamber. It's an advanced autoclave. As I said, the steam is not directly in touch with the hydroclave, with the waste. It's in the outer chamber that the steam keeps moving around, and the waste is inside an inner chamber where it touches with the steam and it gets disinfected. The steam is injected into this wall, that's a jacket of the double chamber, the outer jacket, and the waste is loaded in the inner chamber. The agitator fragments and turns the waste into smaller particles,
Like
smaller sizes. It's like a mixie, yes. So, but and the other advantage with all the hydroclaves and the autoclaves, which I can say earlier, is the microbial disinfection level. That's very, very high, 7 log 10, or that's the disinfection. And the advantages with the hydroclave, which are not there with the autoclave, is we get a dry waste. There we have waste which has some moisture in it, and it's easily shredded here. And internal mixing improves transfer of heat within the waste, because but the other disadvantage here is the recycling value of the waste really goes down, because the entire waste is mixed inside, and so it cannot be recycled. So or the other option is we just send well segregated waste into the hydroclaves, that if it's only a cycle for the syringes, the second cycle goes for the cottons and all, and the mixing doesn't happen. And then the frequent chances where the blade gets clogged in. And the other technology that we've always been talking about is microwaves. We use it extensively in our homes, and we know the advantages that are there. They've been used in bigger hospitals and smaller hospitals as well. The disinfection by moist heat and steam generated by microwave energy. Here magnetrons are used. Basically we have large magnetrons with 2 to 6 magnetrons which generate up to 1.2 megawatt of energy. Here the electrical energy is converted into electromagnetic energy with the help of these magnetrons. The microwave creates an electromagnetic field, as I said. The water and other molecules, they align into this electromagnetic waste, and then it's a faster process, because within half an hour at around 90 degrees centigrade we are able to disinfect the waste, because of the heating of the molecules. Here the molecules, they themselves generate the heat while vibrating, and the external heat is not there. The advantages and disadvantages with the microwaves. The advantages are in use, it's been used for many decades, as I said. Minimal emissions if no hazardous waste is fed. Automated systems, you don't have to use your hands. Like in incineration, the waste is fed frequently. The chances of burn injuries that happen with the incineration, you open and check, And but with autoclaves, hydroclaves and microwaves, they're automated systems, and you just have to set on the cycle, the 30-minute cycle, and then you open it. Then no, and this microwave, you have no liquid waste, that is the liquid effluents that are there. But there are certain disadvantages also, as the hydroclaves and the autoclaves have a relatively low capital cost and running cost. The microwaves have a higher running cost because more energy, you use more electricity, but of very much less than incinerators. Toxic emissions of hazardous waste is fed. And microwaves, here you cannot put in large metal items because you have sparks and all that are there. So it's advisable not to use any large metal item. It can damage the shredders and the microwave system. The odors are produced again here. But for odors, we have certain deodorizing liquids that are available, which are put for all of these technologies. Probably of microwave energy leaking. So we need to make sure and very frequently keep checking the microwaves, that the microwave energy is not leaking out into the atmosphere. It will be very hazardous for the healthcare worker who's operating it, and it could lead to mutations, the microwave energy if it's leached out. So we need to make sure that the systems are being checked frequently. And then we coming to chemical disinfection, the chemical treatment. Again, these have been used for a long time. The different chemical disinfectants that are used in the healthcare facilities, sodium hypochlorite or the bleaching powder, it's most widely, most common disinfectant, cheap, efficient, and it's used within all the healthcare facilities, right from bigger tertiary healthcare facilities to smaller sub-centers and primary health centers, because it's easily available and can be used, and it's the chemical efficiency, the disinfection efficiency is also good. Then the other ones that are used mostly are glutaraldehyde, paracetic acid, ozone gas, calcium hydroxide. These are oxidizing agents which are used within the healthcare facilities. There's another alkaline hydrolysis technique that's an emerging technology that's coming up for treatment of healthcare waste, especially the anatomical waste, just to come out to have a non-burn, totally a non-burn system. We're having an alkaline hydrolysis system that's been evolved. Here it's in hydrolysis of the anatomical part with using heavy chemical loads. But here still the question is, there are a lot of chemical the pollutant, not heavy metals because it's anatomical part, but the chemicals that will be there, quantity of chemicals that will be too much, and also the water bodies and the water treatment systems will have more. We need more efficient water treatment systems then.
And what are the type of waste that you generally use for the chemical treatment?
You can use any for chemical treatment. It's actually you can use any all kinds of systems excepting the anatomical waste, but rest all kinds of waste are recommended. You could, especially they used for the gloves that you have, the syringes, the needles. After cutting them, you just put them into it. You remove the barrel and the plunger, and then you put the syringes into the chemical disinfection. It's just, it's important because chemical disinfection is important because you make sure that the waste has been treated in front of your eyes, and you know that you're not transmitting the infection. So at least that's on-site treatment, and that's one barrier, the first barrier that's there to stop the infections, and then it could be recycled. But again, here, as I said, the cytotoxic and the genotoxic waste cannot go into any of these technologies. So that has to be made sure, and rest all it could be used. And microbiology waste also can be sent in here. But yes, it's advisable that you send them for autoclave, because the spore disinfection doesn't. You don't sterilize the waste with the chemical disinfections. It's only disinfection. So that's the thing. And then that's where now if we have, as we've been discussing, choosing the technology would be based on the healthcare facility, the kind of waste that we generate, and different criteria that are there. If you have a centralized facility, do you actually need a facility within the healthcare facility, within your hospital or your facility? So these are different criteria that you need to have while choosing for a technology. Reduction of waste and volume, so that we've discussed on. So you need to depending on the size of your facility. Do you have enough space within your facility for waste treatment plant? Occupational and safety of healthcare workers, noise and odor that has been produced, automation, reliability, manufacturer background, the cost, recurring cost in maintenance, after sale services, level of operator training, other manpower requirements. As a manpower operator training, I'd see that incinerator operators and all of these technology operators need to be trained well before they have been given the assignment of using any of these technologies. So, and especially when it comes, if there's any default, so they have to be well equipped when how to handle the technology. So that's important here. Again, training plays a very important role here. So that's how choosing a technology is important. And as I said, the choosing of technology, you should decide, do you actually need a technology within a setting like Delhi, where you have already 4 centralized facilities that are there and which have all the different treatment technologies available. So because it's cost effective not to have a treatment technology within your healthcare facility, only chemical disinfection could do, and you just segregate your waste very well, contain all your syringes and needles in punch-proof containers, and then send it to the centralized facility which could do the disinfection, mutilation, sterilization and all. And there's one more important thing that we need to, when we're talking about disinfection, is after chemical disinfection, we should not subject the waste to incineration, because we are again producing chlorine byproducts, and when we heat them, we'll have a lot of PVC, the chlorine emissions that will be there.
Regarding the central facility that you are mentioning now, there are some recyclable things like the linen, the laundry and all. That of course I think you can do it, or do you suggest that also to go
we're
to
just talking about the waste here. It's only the waste management, not the ones that are used, not the reusables, only the waste generated within the healthcare facility should be sent over to the centralized facility. Here again it's your choice to keep the syringes with you or not, so that you have a good revenue that's been generated after recycling. But otherwise, all laundry and all the reusable items within the hospital should be
have to evolve their
own methods for that. And evolving technologies, as we just briefly will touch upon, the different evolving technologies that for waste management nowadays. We're trying different technologies for waste management. So irradiation, it's using X-rays and gamma rays, where with these different rays, gamma rays, we subject them to the waste, and then and then the waste, the composition of the waste actually changes. And the biological systems, enzymes are being used. Here again, it disrupts the cell walls and all, and then the biological, the whole cell composition changes. Composting and vermiculture that's being used, but we should make sure that before sending it for vermiculture or composting, the waste is should not be infected. Depolymerization is another technique, and alkaline hydrolysis, as I already touched upon. And these are emerging concepts when we talk about waste management. There are certain emerging concepts that are coming up. Solar energy is also being used for waste management. There was a project that was done with an internationally a chain of NGOs called Healthcare Without Harm, where the innovative concepts were being tried. So solar energy from India, Chowthram Hospital, they had one of these systems that they had devised, and it was an award-winning technology where they use solar energy to run an autoclave. So using natural based systems, and then these are certain concepts that are emerging. Are green purchasing, earlier we've been discussed, is that don't go for prevention is important. So we need to make sure that we don't use certain things which would generate waste. So using burn technologies is one, using not using hazardous substances in the facilities, like don't use mercury in your blood pressure instruments, things like that. Sustainable hospitals, so not only green purchasing where we have a lot of bundling, you do purchasing where not one thing is purchased at a time, but you have a whole group of items that have been purchased together. And then sustainable hospitals where it's not only talking about waste, but the entire hospital, the pest control of the hospital, the paints that are used in the hospital. You don't use a lot of lead on the floor cleanings, and also just to have sustainable hospital concept, and then zero waste concept, that's emitting, that you try to generate minimum waste within your facilities. So these are the emerging concepts. I'm sure next time we come we'll have some more there.
So here I would just like to make, is there time for it? The thing here is, as she pointed out, it's all very well to use the autoclaves and microwaves and all that, but one must know how they are working. They should be working efficiently. So you have what is called as these indicators, biological indicators. They tell you these tests should all be in place so that you know your microwave and your autoclave is working all right. So if you say the autoclave has to achieve this much temperature, how do you know whether it's actually sterilized your items or not? So you have to use these indicators and make sure your systems are all in place and that your equipment is working appropriately.
Yeah, with the automated ones you already have this a computerized system that's there within the...
It's all,
yeah, so where you have a strip that keeps telling you the pressure, the temperature that's there within them. But
for every cycle.
For every cycle. But still it's important to use the spore strips to check the efficiency. Yeah, that's very important. For any of these technologies, I guess it's important. So that's it on the technology now. I guess.
So thank you, Dr. Megha, for this presentation, in which we learned that there are various technologies available, and these we can choose from among these technologies depending upon a number of factors, and those factors have also been listed. That is, it could be the cost, it could be the availability of the space, availability of the manpower, the trained manpower which is available, the space which is available, and the type of waste which is generated. So there are a large number of factors which decide as to what technology needs to be used, and of course we need to be careful that the anatomical waste that cannot be very easily subjected, and it should not be in fact subjected to microwave or hydroclaves, and it can only be sent for incineration. Deep burial also. And another very important thing that was mentioned by Dr. Megha is that especially for small facilities it is better just to disinfect the waste, and for the waste management they can be transported to the central facility where they will be managed further on. So I think now we can come to the second topic, and that is on wastewater management, and I would request Dr. Sumati to discuss upon how will the wastewater be managed.
Okay, thank you, Dr. Kuba. Yeah, another important topic, managing wastewater from healthcare facilities. So firstly, let us see what are the sources of wastewater in any healthcare facility, whether it is a small nursing home type of a place or a large hospital. You have the wastewater coming in from the operation theatres, laboratories, the labor rooms, the wards, mortuaries, CSSD plants, that is the Central Sterile Supply Department, the laundries and the hospital kitchen. So you have wastewater being generated from all these departments. I mean, this is just a sample representation, but there are many more like the wards and the minor OTs and other places. So the water that's being generated in these places can be infectious, because in a hospital you must assume that everything that's coming out of a hospital is infectious. So what are the hazards from such wastewater from the healthcare facilities? Firstly, you have the microbial pathogens, that is the microorganisms which are disease causing, which can be present. Then you can have hazardous chemical waste, there could be pharmaceutical waste, cytotoxic waste and radioactive waste. These are the various categories of waste that can be generated in any healthcare facility. Coming to the microbial pathogens, so they could be, usually what happens is the enteric pathogens, that is the gastrointestinal system, the bacteria which cause disease in the gastrointestinal system, they are most highly prevalent, like Escherichia coli, Salmonella typhi which causes typhoid, then Shigella is the bacteria which causes dysentery, and Vibrio cholerae, the dreaded organism which causes cholera. So these are some of the organisms, some of the bacteria which are prevalent as microbial pathogens and which could be present in the wastewater. Then there are viruses which can also be transmitted, some of the viral infections which can be transmitted through water. That could be the rotavirus which causes diarrhea and the hepatitis A virus which causes jaundice. Then you have parasites like Entamoeba histolytica, Giardia lamblia, hookworm, the tapeworm. These are the eggs of all these organisms. The cysts and the eggs of these organisms can be present in the water, and they are all waterborne diseases. And the last mentioned is the MDR bacteria. Now what are MDR bacteria? MDR stands for multi-drug resistant bacteria, and this is the most dreaded thing in a hospital. They are the bacteria which are resistant to all the antibiotics that are usually used, so you can't really treat them very easily. So this is really a big problem in many of the healthcare facilities, because earlier we had organisms which could easily be killed and destroyed by the usual antibiotics and drugs that are taken, but in a hospital setup these MDR strains or the multi-drug resistant strains assume a lot of importance. They say that even up to 40% of organisms which are prevalent within a hospital setup belong to this MDR multi-drug resistant category. Then you have the pharmaceutical waste, where drugs which have been unused or leftover drugs, you have solutions containing vitamins, cough syrups, eye drops, IV solutions. All these can be categorized under pharmaceutical waste. So hospital water, why is it specifically important? The antibiotics, I told you about the multi-drug resistant strains. Why are these important? This is just to show you an example, that is the antibiotics, as steadily as they have been discovered, it has been observed that their resistance levels are also increasing accordingly. So the resistance also develops to every antibiotic that has come into the market. So the pharmaceutical industry has to work that much more to bring in new antibiotics which could be effective for all the bacteria, because we find that as and when the antibiotics are introduced, soon they become resistant. So this giving that particular drug is no longer useful. The best example would be in typhoid. Earlier the drug of choice used to be ciprofloxacin, but today if you have a case of typhoid and you give ciprofloxacin, more often than not you will find that the patient does not improve because they have become resistant. So they have switched over to other drugs like ceftriaxone and others. So the resistance is a very big problem. And the radioactive waste include the radioactive material which is used for diagnostic purpose or for therapeutic, that is treatment purposes, or for research, whatever the reason may be. The net result is that radioactive waste is being produced, and they could be in the form of solids or liquids, and they affect the healthcare workers, including the waste handlers. So these are important. Cytotoxic waste used for cancer treatment, and chemical waste, again the medicines, disinfectants, heavy metals. Effluent concentration limits, the guidelines, the Central Pollution Control Board and the Ministry of Environment and Forests, they've all given us the guidelines as to how much, what are the parameters in every healthcare facility to limit these wastewater from becoming hazardous. So
management of radioactive and cytotoxic waste we've not spoken about.
It doesn't actually come into. We don't include them in the healthcare waste category here.
Okay.
Yeah, they just have to be given up to the
BHAVA.
Okay. So they have to not to be managed at the hospital level.
Usually not. I mean, they have to be. You have to store them and send them back, or you wait for the half-life decay time in case of radioactive waste, and then they become like regular waste, and then you treat it that way, like in the sewers and all that.
So, but you need to store it till then.
Yeah, you have to store till the decay time is over. So the parameters for pH, the biological oxygen demand, COD, heavy metals, everything has been laid down by the Pollution Control Board and the Gazette, that is the Ministry of the Biomedical Waste Handling Rules. So whatever the rule says, one has to follow according to that and see that the harmful substances are within limits. So what are the treatment of methods for wastewater in healthcare facilities? You have either you connect to a municipal waste sewage treatment plant, or an on-site treatment. So for on-site treatment you have primary, secondary and tertiary treatment methods. Primary treatment is the physical removing of grit and grime and all that, and secondary would be the biological methods, that is you make the filter beds, you use the rapid or the slow sand filters and make sure that the biological pathogens, that is pathogenic organisms, are destroyed. And in the tertiary treatment you have the chemical treatment using chlorine or sometimes even UV rays then finally you treat the sludge that is left over. So minimal wastewater treatment, minimally every healthcare facility has to manage their waste. They can do it either by lagooning or minimal safety requirements which have to be followed, and the sanitation methods for this. The lagooning would be, it is a technique which is a natural treatment technique and consists of accumulation of the wastewater in ponds. So you set up the lagooning system, which is quite an efficient way for wastewater treatment. And we have seen there is a success story here, the effluent treatment plant for the liquid waste, which has been set up at Chaitram Hospital in Indore. I think Dr. Megha has mentioned it. It is a 350-bedded tertiary care hospital with 22 acres of land. And they have a very good effluent treatment plant system, which actually I think it has been done with the foreign collaboration, I think with the USA. And they are recovering about 3 lakh liters of water every day, and they are treating this wastewater and making it useful for their gardening and to maintain their green belt, and also for the sanitary cleaning purpose. So other than the drinking water purpose, they are using it for all this. So this is an enormous saving in terms of cost, as well as the potential that they have. And the sludge that is generated from the effluent treatment plant is used as manure for the plants. So this is a very good method. I think space is the only constraint, and right now I think in our hospital also, Safdarjung Hospital, it has been sanctioned, and hopefully we'll see it come through in another year or so.
So it's not only management, it's also recycling.
Yeah, it is
recycling of all
you're making use
infectious.
A lot of water that goes waste, you are cleaning it and using it for your own purpose. So this is a very big saving in terms of cost. And this effluent treatment plant consists of all these following the parts. What it contains is the bar screens, oil and grease trap. There is an equalization tank, aeration tank, clarifier tank, filter feed tank, then the chlorine contact tank, and finally you have the clean treated effluent tank, where the clean water is stored, and that is sent off to different parts of the hospital for maintaining their gardens and for the washing and this kind of purpose. So ultimately, just like you have for the other non-water, that is the solid waste, here again you have to use the 3R principle, that is reduce, reuse and recycle. So as far as possible, you have to follow all these methods in order to have an efficient effluent treatment service. So as a parting shot, I would like to convey this message, that the activist is not the man who says the river is dirty. An activist is the man who cleans up the river. So let's all be activists and clean up our healthcare services and the waste management services rather, and the effluent treatment in an appropriate way, so that we make our hospital environment safe. Thank you.
Thank you, Dr. Sumati. Anything you would like to add, Dr. Megha, as far as wastewater management is concerned?
I guess we've already covered, and because of short of time, it will be through the course material that they can get more on that. But yes, it's important to make sure that the water that's going out of the healthcare facilities is not polluted, and we have minimum, because the heavy metals cannot be treated by any of these technologies. So we need to make sure that not much of heavy metals,
we don't use too much of them,
and dispose them into the water bodies. That's one thing.
Yeah, we've already spoken about mercury, and I think
lead and mercury, cadmium, all these.
So that's very important. So I think as important as the waste management, similarly the wastewater management is equally important. And
it's not been talked about much.
Usually neglected. Everybody concentrates on the solid waste management. That's the usual trend.
And we can do a lot from that success story of Chaitram Hospital, that we can do a lot by reusing and recycling the water which has been rendered non-infectious.
It's done in industries, but in hospitals it's still.
That's because probably, as she said, the lack of space, because
effluent treatment plant requires a lot of space,
and requires a lot of cost input also. I think, of course, we are saving a lot, but
your initial input of the cost is also quite high. But then in the long run, in a big setup, a big hospital, you make it up.
Okay, so then I would just like to thank Dr. Megha and Dr. Sumati for very interesting presentations, and we expect that we will be getting some questions through email maybe from you people, and I think I can forward those emails and we will be able to give you the reply. So thank you once again.
Thank you.